we've all heard that saying, life is not fair. So I just saw that in real time. You'd have a 90-year-old in room 2 that lives and a 20-year-old in room 3 that dies. It just sort of haunts me because he was kind of calling out for his mother when he was dying. He was in his 20s. I want my mom, and that kind of haunted me. Also, you could make someone have what's called a good death. You could talk to the family, you could talk to the patient, you could see what their wishes were. You could make it a good environment for them to die peacefully.
All right, Sharon Kent, welcome to Tales from the Shift. How are you today?
I'm great.
All right. I'm so glad to have you here. A critical care nurse. So why don't you just start us out real basic? What is an overview of a critical care nurse?
So a critical care nurse, to me, is the eyes and ears for the doctor, for the sickest patients in the hospital. So the doctors will round and leave, but we're with the patient for 12 hours. So often it's the critical care nurse who sees the sign that the patient's deteriorating and can get care quickly for the patient.
Why did you end up being a nurse? How'd you get into it?
Well, a little bit of a roundabout. I wanted to be a physical therapist first. And I was in college and I went to a meeting where there were about 4,000 people who also wanted to be a physical therapist in the room. And they only accepted 15 people into the program.
Oh, wow.
And I thought, oh, this route is going to take a long time, longer than I want to spend in school. So then I thought, they told us things that would give us a leg up. And one of them was to get work experience in a hospital. So while I was in college, I went to an adult school to learn a trade to become a nurse's aide, which is basically entry level to get you in the hospital. So I became a nurse's aide, start working in the hospital, and then was able to view up close and personal what the nurse does, what the physical therapist does, what the differences are. And I thought, the nurse has much more variety, a lot more tools at their disposal. And I applied to 3 nursing programs and I got in all 3 of them. So I thought, okay, that'll shorten my time in college and I'll come out. And there was a big nursing shortage at the time. So it seemed like that I could instantly, in fact, I got a job 6 months before I graduated. So
yeah. So it seems like we're still at nursing shortages, at least
yes.
what I keep hearing. How many years did you end up doing it?
I ended up being a nurse for 38 years.
Amazing. So you've seen a lot.
I've seen a lot.
So I don't know if we can get all those things out in one show, but we'll try and get out, some of your best stories and some of the things you remember. So we're excited to hear about that. Let's say someone they're on their first day. Why might someone quit on day one? What's something that might happen or affect them?
Being exposed to so many bodily fluids, because sometimes that's shocking and you get it on your person, on your hands, on your uniform. So that would make someone want to quit on day one.
Is that, would you say that's a daily thing or just
in the
just
ICU?
happens
Pretty much.
Really? Oh,
Because
boy.
you got sick patients and they can't always control bodily fluids. And sometimes you're rushing in an emergency situation. So you don't have a lot of time in my early career, we didn't wear gloves a lot. And then the doctor starts saying, you should wear gloves and you shouldn't touch blood and you should. So now they're very conscious of protecting yourself against bodily fluids. That's the reason the nurses are told to wear gloves anytime you might come in contact with any bodily fluids.
Yeah, I see them. Not only are they putting on a different pair of gloves every time they have a different patient, but they're also using the hand sanitizer as they come in and out of the room. I can't imagine. It must be 500 times a day that they're putting hand sanitizer on themselves.
Well, you'd be surprised. We actually did a silent hand washing audits to make sure people were actually washing their hands.
Oh, and how'd that go?
Mm-hmm. The doctors were the worst offenders. The nurses are better than the doctors.
Really? Okay. Is there any time you remember someone else making some sort of like a dangerous mistake in your career that you can remember?
Well, more like an omission. I mean, sometimes there's delay in treatment and the one that sticks out early in my career and has stuck with me for a long time is I was helping move a young patient to the ICU via bed because he was on the floor and he was very agitated and acting up, and we drew a blood gas, which is a measurement of the oxygen level in your blood. And when they drew it, his blood was really dark. And I said, something's wrong with this patient. We got to get him to the ICU. So we rushed him into the ICU. And on the way in there, I saw an anesthesiologist who was walking out of the ICU. And I said, you need to intubate this patient now. And he looked at me and he said, I don't take orders from a nurse. And he walked away. So I brought the patient in the ICU and I saw one of my doctors that I worked with all the time, a pulmonologist. And I said, you need to intubate this patient right now. And he said, okay, let's do it. And he was unable to do it. It was difficult. And the patient ended up dying. So I think that the delay by the anesthesiologist caused the patient's death.
Yeah. So why couldn't he intubate? Was it blocked in the throat?
It was difficult. The airway was difficult and the patient was very agitated, and we basically just kind of lost time. And the patient was young. The patient ended up dying. It turned out he had a cardiac condition that was congenital he'd had from birth. And so it was basically his heart that brought him into the emergency room. But I was so upset. And I actually asked to speak to the administrator of the hospital and complained about the anesthesiologist. And it's not about, I'm a doctor and you're a nurse. This is what was best for the patient. I was able to recognize what the patient needed. And I was trying to convey that and get care for the patient.
Right.
So
right.
that one was hard.
Yeah, it seems terrible that someone's hubris would be in the way of someone receiving the care that they require. And you're all a team at the end of the day.
We're all a team, but there's this hierarchy, and sometimes the doctors don't play well.
It's a shame. That's a shame. How often was it that that when you tried to intubate someone, it was not
Pretty much,
successful?
it was a lot of times the emergency rooms doctors will come or the anesthesiologist. So that's what they do routinely.
Mhm.
But I don't know if there's this new show on, it's called The Pit, that everybody's talking
Yeah.
about. They show a lot of them trying to intubate patients in the ER. And some can be difficult. Sometimes the airway fills with blood, and sometimes the airway's abnormally shaped, and the neck, there's problems with the neck. So it's a procedure that takes skill.
Can you tell us a time when you learned that a certain unwritten rule exists as a nurse?
Well, what I saw, I worked basically at 3 different hospitals, but the hospital that I spent the most time at, I kind of saw that when the doctors, you have a general practitioner and then you need surgery. Well, oftentimes the doctors would refer their friends to the patient versus maybe the best person to do the job. So you need surgery, so I'm going to call in my doctor friend. So the doctor friends gave each other the referrals and the business.
And they might not be the right
they might not be the
person
best
for the situation.
person, right? They might not be the most skilled, but they were their friend. Yeah. So I think that was sort of the unwritten. And patients are, most of the time, they're very trusting. And nowadays you can look up your doctor online and you can look at, comments about them. But back then called the good old boys. Yeah. They would refer their friends to give the business to their friends.
So what were the shifts typically like? Like what kind of hours would a nurse typically work?
When you first get out of school, pretty much the only thing open to you is the night shift. So my first job was on the night shift. So it was 7 p.m. to 7:30 a.m. And then what you do is you put your name on a list to get on the day shift. So when someone retires, someone moves, moves out of the department, they go down this list and then so I was on the night shift for the first year I worked, and then I got on the day shift.
So the people on the day shift are more likely to have more experience than if you're
usually they're more experienced. The night shift are all the new nurses, but sometimes the experienced nurses like the night shift because the hospitals would give you a differential, so you'd actually make more money if you worked on the night shift.
Okay.
They paid an incentive for people to work the night shift.
What kind of like a 10%, 20%? What are they?
I think it was like 10%. So it was a
Okay.
couple more dollars an hour, but sometimes it helped.
What about holidays or Sundays or anything
Holidays
like that?
typically was time and a half on holidays. And then the last hospital that I worked in, I was in management, but the nurses got double time and a half on holidays.
Double time
And
and a
they got
half.
double time and a half. So we
Wow.
never had a trouble staffing the holidays.
I would
Nurses
imagine.
wanted to work the holidays. They didn't want to work the day before. Like we'd have everybody wanted to work Christmas, but nobody wanted to work Christmas Eve. So
Right.
that put another potential problem is you couldn't staff around the holidays. But the holidays you could staff.
They made it too attractive to work
Too
the
attractive.
holiday. Yeah. The fine balance needs to be found there, I guess.
Yeah.
Interesting. And so and then overtime was that typically like a time and a half
Overtime
kind of
was
a thing?
usually it was 12-hour shifts, so you got overtime, you got time and a half after the first. Well, you got straight time for 8 hours and then you got time and a half for 4 hours and then you got double time after 12 hours.
Oh,
Could make
okay.
essentially you were working 72 you were working 3 12-hour shifts, but you were in a 2-week period, you're working 72 hours but you got paid for 80. There was a
Okay.
formula that was considered full time.
Okay. Okay. Can you tell us basically the worst day you ever experienced on the job or maybe even the best?
Okay, the worst day was after the 1994 earthquake in California.
So
So
what happened then?
I got up. It was not my day to work, but we had an emergency triage thing at the hospital, and there was one of the freeways was actually cracked. So anybody that lived north of that was having trouble getting into work. Anyway, bottom line is I knew I should go to work. So I went in and I was an ICU nurse. But as I'm walking in the building, they said, no, no, we need you to go to the emergency room. We need everyone to check into the emergency room. So I was put in the emergency room because it wasn't my day to work the ICU, the shift. And then I was paired with a surgeon. We worked together all day. They paired, this ER had 10 rooms. They paired a doctor and a nurse in each room. And all we did all day was suture patients up. And we basically threw the instruments in a bowl of like alcohol or something. Like it was very rudimentary medicine. We couldn't stop to clean things. We saw over 400 patients in one shift.
Amazing. Wait, so you saw 400 patients or the
No, the hospital that day saw
okay.
400 patients
Okay.
in the day shift, and I was one of the 10 nurses
Okay.
that were working in the ER.
Yeah. So you said so sutures, so a lot of people just had maybe shrapnel type things from
Well,
the
what
buildings
happened
or
is a lot of people have pictures on their walls or things, so things fell down and a lot of people jumped out of bed to run outside and ran down their hallway in socks or bare feet and cut their feet up. A lot of people cut their feet up. A lot of things fell off shelves or walls and hit people in the head. So just a lot of suturing from cuts and wounds.
okay. What about a best day? You remember anything?
This was when I was a manager, and there was a patient that the doctor was seeing, and he told the patient, "You need to have a pacemaker, sir." And I was like, I don't know. I'm thinking about it. I don't know. I don't know if I want to have a pacemaker. Anyway, the patient was on a monitor, and of course his heart started to slow down, dangerously slow. And so myself, along with 2 other nurses, we got the patient, we wheeled him in his bed. I cleared out a procedure room next to the ICU. I called the cardiologist and I said, "You got to get down here right away. This patient needs a pacemaker." Mind you, he could have had it done electively and take your time in the OR, but that wasn't the option. So, emergently in this procedure room, myself and the doctor and 2 other nurses, we put in a temporary pacemaker in this patient. And then afterwards, the cardiologist was so impressed, he went up to the administrator of the hospital and told them how I had made this happen. And basically, I had saved this patient's life.
Amazing. I mean, it's really cool that you could be involved with something like that to help
Yeah.
someone. you know?
Again, to be able to recognize it, but the fact that the doctor listened to me
Yeah.
and we were able to make it happen. We had to kick another doctor and patient out of the procedure room so that we could bring this patient in. It was just one room they had for elective procedures, kind of like an overflow room.
Yeah.
And we were able to scramble and get all the equipment. And the doctor was really impressed with how fast we were able to work, and the patient lived.
Yeah. Yeah, imagine if it had been like the cardiologist. He said, "This person needs a pacemaker," and they go, "Hey, you don't tell me that they need that, right?
Exactly.
I'm going to
Exactly.
lunch." Right?
Exactly.
I'm glad they listened.
Different hospital, different hospital.
Yeah, amazing. That's awesome. I noticed when I was at the hospital recently that they had a sign on the wall. Basically, if you had to sum it up, it said, "Please don't hurt the nurses." So I'm wondering if you ever felt unsafe on the job with any of the patients.
Well, I had one patient who was an overdose patient, and overdose patients usually have mental problems. Anyway, and I was trying to help her, and they people with the overdoses or with suicide attempts, like they couldn't have certain silverware, and like you had to keep the tray safe and do all this stuff. And the patient, she got really upset at me, and she spit on me, and so it was like unexpected, but she just spit on me because she was mad that she couldn't have a knife or something. I don't I don't remember. So
Well, that's assault.
yeah, yeah. I mean, nurses sometimes were the scapegoat. The patients get, they get angry at the nurse.
Yeah.
They take it out on the nurse.
Yeah. I mean, I think you got out of it in time where you probably don't have to deal with the people now. I would imagine there's a lot of, well, the AI told me or Google told me that this is my problem and I need you to do this, whatever. And probably people are wrong a lot of times. That must be
Well,
very
the
frustrating.
doctors, yes, they complain about WebMD, and I worked at a time where people didn't have their cell phone in the room with them, and they trusted the doctors more.
Yeah.
But sometimes patients can be very demanding, and they think that they look at care they see on TV or they read online. So yeah, that can be problematic.
Yeah. I would imagine. All right. Um, how about at work? Have you ever gotten in a fight with anybody?
This is pretty funny, I guess. This was early in my career. One of this neurosurgeon who was a total jerk came up to me and said to me, "Did physical therapy walk my patient?" And I said, "Well, I'm not sure. Let me look in the notes. Let me see." And he goes, "I can't believe it. You ask a nurse a simple question and she can't answer. And let me call the physical therapist." And I go, "Excuse me, a nurse? I mean, you're a neurosurgeon. You only know about the brain and the head. If I ask you a question about the patient's lungs, wouldn't you go talk to the pulmonologist? If I ask you a question about the patient's kidneys, wouldn't you go get a nephrologist?" So I just laid into him in front of everybody on the floor. And this other doctor came up to me afterwards and he said, "I'm really impressed with how you talk to him." He said, "I'm going to call you ma'am from now on." It was just a joke. But this doctor was known to like throw things in the OR and just was really a jerk. I think they ended up firing him at one time because he was so abusive to the OR nurses. But that was his thing, was intimidation. So I just stood right back up to him. Like, he was complaining that a nurse didn't know about a physical therapist
Right.
role, but doctors are very specialized. They don't
Yeah.
know about each other's roles.
No, it's a great retort that you had
So I
because you're
just gave it
absolutely
back.
right. Yeah.
Anyway,
Fantastic.
that was it.
Oh, okay. Would you say is there is there any way that you feel like the job maybe has affected you or changed you as a person?
We've all heard that saying, life is not fair. So I just saw that in real time. You'd have a 90-year-old in room 2 that lives and a 20-year-old in room 3 that dies. So I saw a lot of inequality in young people dying and old people living. And you see a lot of death when you're in the ICU. Not that you become numb to it, but when an old person dies, you think, okay, well, they had 90 years. But when a young person dies, you're like, oh my God, they were 20 years old.
Yeah.
So I guess that reality, that life isn't fair.
Yeah. So like you said, you see deaths often. How does that
Mhm.
affect you? I mean, how does that affect you? Do you feel like you, I don't know, PTSD? Like, what do you get out of that?
Um, no, not PTSD, because in the ICE, I think that might be more in the emergency room. In the ICU, a lot of times we've cared for the patient. So say that you have a really, really sick patient and you've cared for them for weeks and weeks and weeks, and you've done everything you can, but they didn't survive. So we a lot of times get an opportunity to make a relationship with the family, and they can see that we've done everything that we can do, because we're dealing with the sickest patients all the time. So you really see that did everything you could do medically, called in all the consults, got the good treatment, and then you could even see so I had some extra training as an end of life nurse specialist that helped people get through it, but you could make someone have what's called a good death. You could talk to the family, you could talk to the patient, you could see what their wishes were, you could make it a good environment for them to die peacefully. So that was gratifying too, that you could kind of help people through that.
Yeah. How often would you say that the person was alone and really only you or your staff were there for them?
On the day shift, not that often, but on the night shift, that it could happen.
Yeah.
Again, because people would go home. We actually instituted 24/7 visiting. And that was a groundbreaking thing that I had to kind of fight for. I was sent to a conference that was run by the IHI, the Institute for Healthcare Improvement. And they came back and they said, you should have unlimited visiting because you shouldn't restrict people at this very sick time. And so I kind of had to fight with the doctors on it. The administration was for it because they were the ones that sent me to the conference. And it was proven that you should allow people to have, we didn't have, 20 family members, and we tried to limit it to 2 people because of the space. And if the nurse had to get to the patient, I told the nurse, like, you would set the chairs up so they could sit there, but you could also rush in and get to the patient if you needed to. But so that really helped people have people around them when they were dying. But on the caveat, we could only, due to the health Department of Health, you could only keep the body in the room for 2 hours after the death because the body would warm up too much. So you actually had to bag the body and get the body in the morgue. So sometimes people missed that window, and they were pretty strict about the window. We also needed the bed for another patient, which is kind of just the reality of the situation.
Yeah. Like turning the table at a restaurant.
Yeah, yeah.
Um, I've heard about people when they're at the end stages that there sometimes there's a lucidity where they,
Yes.
have you seen that? Have you experienced that?
Yes, they'll look around the room, they'll recognize people, and we tell people that hearing is the last thing to go. So go ahead and talk to them, because even if they're not looking at you, again, if they have a tube in their mouth or something, they're going to hear you, or they'll squeeze your hand, or just be around and touch them and be present.
Hey, quick timeout. If you made it this far in the video, then you must like it at least a little bit. If that's the case and you want to see more, then please like and subscribe, and I'll keep bringing you this content. And it helps YouTube figure out that people actually like this, and they'll send people this way, and we'll grow. With your help, I really appreciate that. Thank you. Is there a person or an event, a situation that you still think about today occasionally?
Well, probably that case I told you about, that young kid dying. It just sort of haunts me because he was kind of calling out for his mother when he was dying. He was in his 20s. I want my mom, and that kind of haunted me, that we couldn't save him.
Yeah, that's rough.
Hmm.
How about mistakes? You make any mistakes on the job that you can recall?
So for 4.5 years, I worked in a cardiac cath lab, which we did procedures. And I don't know if you've heard of stents, where we put stents in patients' coronary arteries.
Yeah.
So when you took the stent out of a package, you had to uncoil it, if you will, and stretch it. And the stents were, thousands and thousands of dollars. So we were putting a stent in a patient, and I uncoiled it and stretched it, and I hit the end of it on the monitor. that was hanging over the bed while we were doing the procedure. So in essence, I contaminated the product. So they didn't dock my paycheck, but it was a costly mistake because then that product was unusable.
Yeah. So then
So
you just go to
we
your
just had to
boss and you
discard it and
say,
get another one. We just
yeah.
we had shelves of them and we would just pull one out of the box.
After you got involved with nursing, was there anything that you were surprised to learn that was sort of enjoyable or maybe a benefit of being a nurse that surprised you?
Well, I think the like the friendship and the just the whole hospital atmosphere, I really enjoyed that. Just intermingling with all the different departments and the different people. And it just, again, it's almost like a family. People wanted to help each other. People in different departments. We had this housekeeper, and she was always like, again, if there were bodily fluids on the floor, she ran in, oh, let me get that, let me get that, let me mop that for, she would try to help us, and just how people helped each other. And I think that, you want, in some work environments, people are competitive. There was no competitiveness. We were always just helping each other because the whole goal was that every patient, obviously, if you have a ICU full of patients, somebody's going to be a really sickest patient and somebody's going to sleep through the shift or somebody's going to be an easy patient. But everybody rallied around the sickest patient and the nurse who had the sickest patient or the worst assignment. We'd all help each other. What can I do to help you? Can I help you? You didn't get a break. Go take a break. I'll help you. I'll watch your patient. You know.
I interviewed a paramedic before, and it seems that maybe there's a similar thread here where people that are involved with jobs that you're kind of in the trenches and you're
Mhm.
dealing with very important things, life and death type situations, that it sort of bonds people together.
It
Uh,
does. It does. Yeah. Because sometimes you're just in the middle of something and you need a piece of equipment, or the famous thing was the isolation patients. You would go in the isolation room and you'd be in the room, you'd be all gowned and gloved up, and then you needed something. So you'd go out to the desk. Can somebody bring me this? Can somebody bring me this? Or, and people usually would help.
what would you say is a question people ask you about your job that you wish they would stop asking you? And extra bonus points if it's something that I've asked you so far today.
Uh, um, do you see a lot of blood? Because of course I see a lot of blood.
Yeah,
I'm in the ICU.
I see.
Kind of the blood and guts, they
Yeah,
talk about blood and guts. It is.
yeah,
But again, it's like someone's not shoving blood in my face. It's like part of their wound or part of what's going on with the patient.
right. Did you have any issues when you were first starting out with queasiness and
Not
seeing that stuff?
not at
Not
all.
at all? Wow,
I wanted to go in the ICU. Yeah.
that's
But some
amazing.
nurses do. Some nurses are afraid of needles. Some nurses don't like blood. Some nurses don't like bodily fluids.
Why do you think for yourself, why do you think that is, that it never really bothered you?
Um, Boy, that's a good question. I'm not that queasy of a person, um, in general. So I'm pretty much not a lot of things bother me.
Well, good for you, because I would imagine I would I would lose it. Can't handle, I can't handle my own blood mainly, but other
Yeah,
people's blood would
yeah.
bother me too, for sure. All right. Okay, so on a previous episode, we had Dr. Couture's on, and he's a pediatric physician, also Olympic sports physician, and he has some questions for you.
Okay.
His first question is, do you ever get to hear from patients who have recovered under your care?
Yes. Yes. That was very rewarding. People would often come back and visit us after they got out of the ICU. They'd come back in, and that was very rewarding. And sometimes families, we would hear from them later. They would bring in, a lot of times the families wanted to reward the nurses, and when I was in a management role, they would come to my office. What can I do for your nurses? And I said, well, like a tray of sandwiches, or they really like that. And people, you know, that is a rewarding thing.
Yeah,
And
yeah.
one day, this family member of a patient I was taking care of found out it was my birthday, and they went and bought me a birthday gift.
Wow.
Yeah, during my shift because they felt sorry for me that I was working on my birthday.
So I was reading on the internet that it looks like there is a continued shortage of nurses.
Yes.
78,000 full-time nurses are short in 2025. How do you feel about this? Do you think there's a fix, or what's your opinion?
No, no, it's real. It's real. A fix. A fix is difficult because it's the training. When you are in school and you're training the clinical where you're actually working in the hospital, in the classroom we had 50 students in my class, my graduating class. So in the classroom, you could have the 50 students, but then when we got out on the floors, we had one instructor to 8 to 10 students. So the problem is a shortage of also nursing instructors. And then when you do the clinical, or when you first come out of school and you get into a hospital, I was in another 3-month training program just to become a critical care nurse. So pretty much for the first 3 months of my career, I was considered non-productive. I was being paid, but whoever I work with, that person got 2 nurses for 1. And hospitals view hours as productive and non-productive. So they really struggle with the non-productive hours. And it takes a while to train nurses in any field, but it's the training that's lacking in the schools. There's not enough schools. And then when you get in the hospital, they don't value the training. And if you don't give someone a long enough training period, a lot of nurses just quit because they can't handle the reality of the work because they feel unprepared for it.
Mm.
A lot of nurses they're put in like positions above their skill level quickly. Like kind of tag, you're it. We don't have another nurse. You got to fill in, or you got to do this.
So you said the schools don't prepare enough. Is there really no hands-on at the schools, or,
Well, yeah,
or
the
what?
schools, there's hand on. It's just that there's just not enough physical bodies as nurses because of the clinical. No, I had great training. I went to UCLA and we had great training because they had a huge hospital and a lot of cases, and they had an ICU on every floor, and it was really good training. But again, only 50 of us were graduated out of that 1 year, that one class. So your numbers are just small.
You may not have an answer for this one, but what is the worst movie or TV show that depicts your job? Can you think of
I do
anything?
have one. I
What is
do
it?
have one. It's an older one. Remember Trapper John, MD? It was filmed at the first hospital that I worked at. And Trapper John, MD, he lived in like an old motorhome, and it was out in the parking lot of the hospital. And they filmed it while we were working. We could see him. Well, they had all the nurses wearing high heels. They had like a white nursing uniform on, but they had high heels. We're like, are you kidding me? We're wearing tennis shoes. So it was just like, again, they were trying to portray the nurse as like the glamour or
Yeah,
I don't know. It was just it was on a long time ago, but it was called Trapper John, MD.
that is
Just not
ridiculous.
realistic portrayal of the nurse.
That's funny. Do you have any slang terms in this career that we probably haven't heard that a nurse might say to another nurse or something like
Yes.
that? Okay.
Code Brown, massive loose stool in the bed.
Yeah.
Because you've heard of code blue, which is like a cardiac or respiratory arrest, but someone would say, "Oh, I have a code brown." That means I need someone to help me clean up this patient.
So, okay, so let's say there's a code brown. In the practicality of it, is there like a hierarchy where, okay, you go deal with code brown, I'm not dealing with, like, does that happen,
Well,
or
in ICU, you only get 1 or 2 patients. So
okay.
who's ever the primary nurse would be primarily responsible, and then they'd have to bring in someone else. Because in ICU, most patients can't get out of bed, so you're changing them in their bed, cleaning them and changing them. And
So if someone's in ICU, what's really the longest anybody's generally in there?
oh, we had a patient that was in there for 6 months, and I think she ended up dying, but we were really against 6 months. You probably wouldn't hear of it these days because the insurance wouldn't allow it.
Wouldn't that
But
person go to hospice generally, or?
no, she just she just kept having a series of misfortunes when she'd have a procedure or something. Like she'd have a procedure in her intestines and they'd rupture her intestine, or, she just had a series of catastrophes happen to her, and she never was well enough to get out of the ICU. She ended up dying. But yes, nowadays someone would probably go to a step down or a rehab. Most patients don't stay that long.
So the average length in an ICU, if you had to guess?
Probably 3 days would be the average.
Okay. Okay. And so they can't get out of bed, so you're using bedpans or what have you during that
Right.
time.
I mean, we tried to get people out of bed. We would have, I actually purchased for the ICU a cardiac chair that you could lay flat. You could lay it next to the bed and you could slide the patient over, because studies have shown that if you bear weight with your trunk, it helps improve your condition. You don't get deconditioned. There's a big problem with deconditioning. When you lay in bed, your muscles atrophy. So even the sickest patient, and the nurses would hate me for it, but I'd say, we're going to get Mr. So-and-so up in the cardiac chair. What? Are you kidding me? They'd have tubes and lines everywhere, and we would slide him over even for just 15 minutes and sit him up and then slide him back.
Wow. Okay, so we got Code Brown. Besides
Okay.
Code Brown, anything?
Well, in ICU, we used to have a saying, and we learned it from one of the doctors. It was called the O sign or the Q sign. The O sign means you're sleeping. The Q sign means you're dead.
And when we say, is this an actual sign, or are you saying you would say the words
No,
O
you would
sign?
see it like this is the O sign.
Oh.
And this is the Q. This is the Q sign.
Oh no.
Yeah.
Do you think that nursing might be different in different regions or areas of
Oh,
the United States?
definitely.
Oh,
Totally, definitely.
what might be different?
Well, the thing called ratios. So, California has one of the best nurse to patient ratios in the whole United States. And we found out a lot because we would get traveling nurses and they would come in. California was a very desirable location to come in, one, because of the weather, but two, the ratios were good and the ratios were protected. So an ICU nurse could only have 2 patients or 1 patient. If they were really sick, they were called one-to-ones. And we actually had established criteria that made the patient a one-to-one. And when the patient was a one-to-one, every 8 hours, we had to reevaluate, do they still meet the criteria? Because that's a very expensive patient. You're paying
Sure.
one nurse just to care for one patient. In other states, they would tell us that sometimes they'd have to have 3 or 4 ICU patients. They say, we don't have another nurse. You have to take care of this patient. But in California, the ratio was extremely protected.
Yeah, so I would imagine the outcomes would be worse than if you're spreading
Absolutely.
across one.
Yeah, absolutely.
Yeah.
Yeah.
Yeah, it's a shame because at the end of the day, then money
Again,
has
it's financial.
results. Yeah.
Yes.
You apparently received the Gold Beacon Award
Yes.
for the ICU. So what is that? How'd you get it?
Well, we had to apply, and then we had to be evaluated, and there's gold, silver, and bronze. So basically it was standards. It's basically quality standards. So you had to show them what you've put in place that improved care and saved lives, and there were multiple categories. And you had to write an application, and it's a critical care certification, and it's for critical care units, and it's by the American Association of Critical Care Nurses. And so we got the gold. We had put a lot of programs in place to improve our outcomes based on information we got from the Institute for Healthcare Improvement, which is located in Massachusetts. And they have developed things called bundles. If you do these 6 things, an example is, it's called ventilator-associated pneumonia. So people that are on ventilators for a certain length of time often get pneumonia and often die. Pretty much there's bad outcomes. but there's things that you can do. Simply putting the head of bed at 30 degrees allows their secretions to not pool and not infect themselves. So every single day, we had a 22 bed ICU, we would go around and we would look in the room and make sure the head of the bed was at 30 degrees. And we'd also see how many days they'd been on the ventilator, and we'd remind the doctors. So there were these things we did. We worked as a team. We rounded on every patient every single day. And sometimes it could take up to 3 hours. Another thing was mobility, mobilizing the patients. We had a program where we'd every single day set a mobility goal for the patient. Sometimes the doctors were like, quit asking me, and not today. And I go, no, no, no. Even if we just dangle the patient's feet off the bed today, and I'm going to ask you tomorrow, so you better have an answer, to the doctor, because they're like, quit asking me. The patient just came here. I go, well, it's important. We have to have a goal. So we would set a goal in the morning. We were going to mobilize the patient. We were going to get him up in the cardiac chair. We were going to dangle him. We were going to stand him at the bedside. Something we would do. And then I would have the charge nurse have to evaluate, did we meet that goal for that patient? So it was a lot of work. But again, it was all to improve lives. The IHI is an institute that their whole thing is like saving 100,000 lives. That's their motto.
Really? How might someone find out if their local hospital has done any of these, received any of these awards?
I actually think you can look up hospital scores, and you can look up their quality metrics.
Okay.
And I'm sure Medicare, they probably have to report things to Medicare. So you have things like ventilator-associated pneumonias, central line bloodstream infections, like even surgical deaths. If someone dies within a certain length of time after surgery, it's considered a surgical death. So hospitals keep all these statistics, and that's how they get Medicare dollars. They get lined up with insurance programs. I guess it would just be looking up their quality. They're called quality metrics.
Okay. Is there anything that you learned on your job that wasn't in any of your training, that wasn't in really any books that you read, that you just learned on the job that maybe you're surprised about?
Well, you had to learn how to prioritize your patient care. And I often, I would orient new nurses, and I'd say, okay, you've just gotten your patient assignment, and you have Mrs. Jones over here, and she had a ruptured gallbladder, and she's made major abdominal surgery, but she's talking and she's awake. And you have Mr. Smith here, and he had pneumonia, and he's on a ventilator. Who do you go see first? And right away, the nurse would go, oh, I go see Mr. Smith. He's the sickest patient. I go, wrong. You go see Mrs. Jones, because she's your least sick patient. She can talk. You can go in there and say good morning and talk to her and have her brushing her teeth and starting about her day. Because guess what? You go into Mr. Smith's room, you might get stuck in the room, and then you can't get out to go see Mrs. Jones. And now she's getting pissed off. She hasn't seen her nurse. So I learned to prioritize the care, and it seemed to be backwards. But unless the patient was dying, you go see the easy patients first. Talk to them, get them out of the way, introduce yourself, and then save your sickest patient for last. So I kind of learned that on the job, because often you'd want to rush to the sickest patient, but you get stuck in the room.
Yeah.
So
I thought you were going to say you go to the non-sick or the less sick person so that you can get them kicked out of there. So you're like,
no,
okay, you're good to go,
no.
get out.
You have to, somewhat it's a personality contest. You got to have the patient like you, or they'll complain. And, there's another thing where there's like service. Hospitals are scored on service. And as a manager, I had to do service rounds every day and go talk to all the families and the patients. How's your nurse today? How's it going? So even as the nurse, you want to provide good service. So you're dealing with people at their worst. So they're not always happy, shall we say.
Here's the hot take question. Is there anything you believe about nursing, perhaps, that a lot of people might disagree with, a lot of your colleagues might disagree with?
I believe it's a well-paid profession. I mean, especially these days, people want make a lot of money but not do a lot of work, like influencers or people that go to startup companies or
YouTube channels.
exactly. But I really still believe nursing is a well-paid profession and it's a stable job.
Yeah, well, it definitely sounds stable. And also, when you said that you got to work a 12-hour shift and you're automatically going to have 4 hours of OT on that 12-hour shift,
Yeah,
that sounds pretty nice.
yeah, yeah. And overtime, there's a lot of overtime to be had if you want it.
Um, yeah.
You know, I mean, again with the nursing shortage. But I kind of knew my nurses which ones wanted the overtime and which one didn't. But in the union environment, you had to offer it equally. But certain nurses would always turn it down, and other nurses would say, "I'll take all the overtime you can give me."
So you didn't have any forced overtime?
We did not have any mandatory overtime. No, we did not. I would have to work. The manager would have to work. What you would do is you'd pull nurses off other floors. So you float the nurses. So again, I have the most valuable nurses because they can work pretty much anywhere in the hospital. But what we started is we started a cross training program where we would train nurses on other floors to work as ICU nurses. So we would able to, the whole nursing pool could be used to staff the whole hospital.
Okay. Okay. So when a doctor gets hired, or I should say when a doctor is they have a residency, right? But they go and they try different things. So a nurse doesn't really have to go try different concepts?
You do it in school.
Okay.
Um, most nurses, so when I worked as a nurse's aide, I was in what's called the float pool. They had a float pool for nurses and nurses' aides where you didn't know where you were going to work till you arrived to the hospital that day and your name was on a board and it said which floor you were going to. So some hospitals have that. They'll have a float pool, and those nurses actually get paid more money because they're willing to work on all the different floors. But most nurses are assigned to a floor or an area because you have ICU, you have oncology, you have surgical, you have pediatrics, you have different specialties within the hospital.
Hey, would you say is the type of person this job really isn't for? Other than maybe not being able to handle body fluids.
Um, like people that are, well, I'm sort of thinking more of women, but like someone who's like a princess, doesn't want to get her nails, doesn't want to break her nail, doesn't want to get her hands dirty.
She wants to wear high heels.
Right. Wears her high heels. More of a hands off type person
Yeah.
that doesn't want to touch people. You got to want to touch people
Yeah.
and be close to people. But there's people that want to just use their brain and sit at a desk or be, away from people. You're totally surrounded by people the whole time you're at work, pretty
Yeah.
much when you work in the hospital.
Yeah. Right, okay. So you almost have to have maybe not be so introverted. Maybe you have
Yes. You have to
yeah.
be able to, yes, you have to be able to speak to people. You have to be able to draw people out. You have to be able to convince people to do things.
Okay, so let's say a young person comes to you and they say, I want to be a nurse. What would be the first thing you would tell them to go do in order to get going?
Well, you can pretty quickly train to be a nurse's aide. You just go to like a training program for like 12 weeks. It's best for all jobs, I believe, especially hospital jobs, to get a job in the hospital. So get an entry level job in a hospital and just look at the environment and see what people actually do and get a feel for it.
So do the nurses aid so you find out if you like the work or not.
Exactly. Because the nurse's aide, yeah, you're in there. That's what you're doing. You're feeding the patients, you're bathing the patients, you're changing the patients, you're making the beds. You're doing all that physical work, but you get to observe what all the different roles of the hospital are. Even if you work in the housekeeping department and you mop the floors or whatever, you get in the hospital, you get to see what everybody does. So there's many entry level positions at a hospital.
So let's say someone's a brand new nurse. Maybe they're working for you. Is there anything you would tell them? Definitely do this or definitely don't do this.
Um, Definitely listen to the experienced nurses, definitely, and learn by watching them. And don't complain about the assignments you're given because the assignments are a teaching process. And sometimes you want to challenge the new nurse. We would do that often. We would say, okay, we're going to give you the sickest patient today, but we're all here to help you. because you learn, it's one of the professions you learn by doing. So when you're new, don't complain about the assignment, because the older nurses are looking out for you and helping to train you into an experienced nurse.
Yeah. There's definitely a smell at the hospital. Do you do you think do you get used to it? Do you, I mean,
Oh
because like,
yeah.
yeah, okay, because it just
Yeah,
feels
you get used to it.
it's
Yeah.
very off-putting.
Like a cleaning solution smell.
I don't
Yes,
even
you
know.
get
It
used
reminds
to
me
it.
of biology class. Like it's just you know?
Yeah. You definitely get used to it. Yes.
Okay.
Yes.
All right. How might you personally define success in the career of nursing?
Basically, wanting to go to work and feeling good about your work at the end of the day, and feeling like you made a difference, that all your training was, you know, not an easy school to go through, but to feel like that it was all worth it, and you're using things you learned, and you're mentoring the next generation to continue, because it's one of those kind of continuous professions.
Here is the lottery question. So put yourself back in your shoes as being a nurse full time. If you had won the lottery, would you still go back, or would you be done?
Yes, yes, yes.
Yeah, you would. Okay.
I would. I would.
Yeah.
Yeah.
Okay.
Yeah, I would spend my money on other things outside of work, but I would
Sure.
definitely still work.
Yeah. So getting something out of it, there's a satisfaction then, you're saying.
Absolutely. I loved my job. Yeah.
Okay,
Yeah.
cool.
Yes.
So you received an Everyday Heroes Award. How did that happen? Where'd you get it from?
Okay. In 2008, there was a train crash. There was a head-on collision of two trains near my home in Chatsworth. So, I mean, I hadn't heard about it. It happened around 4:30 in the afternoon on a Friday. So I was driving home from work, and I'm getting close to my neighborhood, and I see all these search and rescue vehicles going into the area. I'm thinking, what's going on? I believe it was September 2008. So I got home and I turned the TV on, and I was looking at the crash site, which was like 3 blocks from my house. And I'm like, they don't have enough help. They need more help. So I was in my scrubs. So I thought, I'm going to go over and help. So I walked over there to help. And they had, police, there was a perimeter. And I said, well, I'm a nurse. I'd like to come help. And they said, we need to see your nursing license.
Like you just walk around with scrubs all the time.
Well, so I went back home, got my nursing license. And while I was home, I got a fanny pack, and I go, maybe I should bring some tape and gauze. And I put a couple of things in my fanny pack. And I went back and I said, okay, here's my nursing license. And so they said, all right, go on in and help. And so I stayed there for like 3 hours helping. And pretty much there was about, 24 people died, and there was over 100 people injured. And I just stayed and helped triage. I helped them triage people. But I remember they said to me, they gave me a little gauze, looked like a scarf. It was supposed to be a sling. And they said, go over there, and this is the engineer of the train. He broke both of his arms, and he gave me one sling. So I went over to him and I said, which arm hurts worse? Because I only had one sling. And I just recall that there were so many people injured and so few supplies. We were setting people's legs in cardboard boxes. We were doing cardboard boxes and wrapping tape. People were bringing us paper towels and water from the neighborhood. Again, they couldn't get in because it was blocked off, but they were bringing supplies for us. We were cleaning wounds with paper towels and water. There was a lot of, because the trains crashed, there was a lot of, people flying forward in their seats and everything. And I was there for about 3 hours helping triage people. And at one point, these poor women, they had to go to the bathroom because they, were coming home from work. And we were near this school, and I saw this building. I said, well, I'll just hold up this blanket. If you want to go to the bathroom, I'll just hold the blanket and cover you. I was able to actually find like an outdoor bathroom, and we just helped people get there, and, and we helped people gather their things. And kind of triaged people. I was in the middle area. I wasn't with the sickest people, but I was with the people that had what was like minor wounds that we were attending to.
Yeah.
So I went there and helped. And then when I got home, I called the hospital and I said, oh, there's been this horrific train crash. I've just spent the last 3 hours there. You might be getting some of the patients. There was over 100 ambulances that came and they dispersed the patients throughout multiple hospitals because you can't bring all the patients to one hospital. And I guess the director of the hospital got wind that I had worked the crash site. And so she nominated me for the award.
Very cool. That's awesome for you to do that. They should have also amended your time card so that you had
Yeah,
get paid for that.
I didn't get paid for it.
So, Sharon, what would you say is probably the most important thing we haven't talked about today? Anything you can think of?
I think that nursing is a difficult profession, but it's also really a rewarding profession. And I think it spills over into your personal life because I'm able to deal with a lot of health issues of my friends and family. And I pretty much, since I've been a critical care nurse my whole life of nursing, I pretty much can stay calm in most any emergency situation. So
Yeah.
I think I'm pretty good with emergencies.
Right. All right, cool. All right, well, now we're on to the speed round. So,
Okay.
speed round is very hit or miss. So, if it doesn't work, it's not your fault. Okay. So, basically, I'll just say some words to you that I found on the internet, and then you tell me whatever you want to say about them. Say you love it, hate it, give me a long story about it. I don't care. Or whatever. You'll get the idea. All right. And if any of these words don't mean anything to you, again, not your fault. Just say I've never heard of this. Okay, ready? Magnet status.
Magnet status. Okay, so my hospital got magnet status after I left, but that's again, it's a recognition your hospital gets, and it helps with insurances. It says that you have met these high standards of care, and you've been given this award by an outside organization that comes in and reviews it. So my hospital has it now, and that's a goal of every hospital to become a magnet hospital.
All right. Travel nursing.
Travel nursing. So I was the manager of the ICU. So in my career, I had over 50 travel nurses. So they come for 12-week assignments. And I would interview a lot of them over the phone from out of state. And they would come in because they like California. And they usually were really good nurses because they knew that they were being evaluated tightly and they were on a 12-week timeline. And then their contracts could be renewed every 12 weeks.
So you feel they're necessary?
Necessary. And yes, they really help you. We bring them in. Usually we brought them in from November till April for the winter season. And it's a way to infuse your ICU, particularly with nurses without paying benefits. You only pay their salary.
Okay. All right. How about this? The phrase, nursing is a calling.
Oh, yeah. I mean, again, it's caring people that want to do it. Sometimes their father died in the hospital, but the nurse was so wonderful to them. They're like, I'm going to be a nurse. Or a woman has a baby and she has a wonderful experience. I want to be a nurse that takes care of babies, so I think it is a calling. I think you sometimes just have seen it in action and think that's what I want to do.
Yeah. Okay. Nursing conferences.
Well, they're fun. There was one that I used to go to called NTI, National Teaching Institute, and it was all critical care nurses. I went one time, it was in Anaheim, California, and there was 8,000 critical care nurses there. So you get a lot of knowledge. And it was a perk. It was a perk that we had. We could go to one conference a year. We would be sent to conferences. It's like a nursing business trip.
Right. Okay. Floating.
The floating is you work in another floor that's not your own floor. And when I was a new nurse, we did it, and they would give you $2 extra an hour to float. When you had to float, it was called a float differential. And then I would always treat myself. Back in the old days, it would be $24. So I would go out and buy myself something for $24 to pay myself for floating.
How about patient satisfaction scores?
Yeah. Well, those can haunt you because after the patient leaves the hospital, they're sent a survey. And then they rate your hospital, they rate your floor, they rate individual nurses. So the hospitals really look at that as a way to improve patient care, what the patients liked, what they didn't like.
So you like the scores, hate the scores.
Well, I think they're a necessary evil.
All right. The full moon phenomena.
Hmm. Well, the full moon is like a old wives' tale that bad's gonna happen because it's a full moon.
So you didn't notice
That's
any extra patients or anything like that?
no,
All right.
no.
Compassion fatigue.
Well, compassion fatigue can be like we talked about, where you see so much death um, that you just think everybody's going to die. You just see a lot of it, and you wonder if any patients are going to survive. I think in the ICU, again, the ER might be more of a problem for that because you see more trauma. In the ICU, after we've gotten the patient from the ER, they've usually been stabilized. So you have more of a story of a disease process and an illness versus a quick, I cut my arm off type thing. So I think that would apply more to emergency room settings or combat nursing.
All right. Well, that's the end of the speed round. Great job.
Okay.
Fantastic.
Okay.
Last question. Final advice. Give final advice for someone who's maybe thinking of getting into nursing.
Well, when we look at jobs today, a lot of kids come out of college and they can't get a job, or they can't get trained. They can't work in a field they were trained for. Their degrees in X, but they can't get a job. I think nursing is, you train to be a nurse, you're definitely going to be able to get a job as a nurse. And it's a very stable career. It's a very respected career. And for women, especially, if you want to have kids, it's a great career because you do have to work weekends and holidays in the hospital, but you also have days off during the week for your kids. You can work around a family. So it's a very, I would say, family oriented type job.
Well, all right. Sharon Kent, thank you so much for being on Tales from the Shift and sharing your story with us.
Okay, thank you.